workers in the public sector who cause financial loss to the state must be sanctioned. That's according to the Chief Executive Officer of the Fair Wages and Salaries Commission, George Smith-Graham. Speaking to Mama Vio Suabuaji on the special edition of the AM show, Mr. Smith-Graham said the time has come for people to be appropriately sanctioned for deliberately causing loss to the state, citing an instance where his outfit has uncovered more than 4,000 ghost names of teachers on their payroll system.
I think that we've gotten to a stage where I believe we need to begin sanctioning wrongdoers. I think the absence of sanctions in the public service is creating some of these challenges. I am convinced that we've gotten to a stage where if somebody causes such a financial situation, distress for the country, we should be able to identify them and sanction them accordingly. So
when are you beginning that? Are you identifying those who caused what is now an outstanding debt?
We will submit our report to government, a very comprehensive report to government. We started this exercise thinking that the numbers were about 20,000. Immediately we started the exercise before we realized that the numbers are not what we are thinking about. It's in the range of about 60,000. And people are submitting information from all over the place. We've issued circulars upon circulars, advertisers' announcements for people to submit, giving deadlines, and people still keep bringing them in. We are going to send another circular very soon that we are not going to take any more application, because for the past 2 months we've just been issuing circulars upon circulars and people are still not submitting. They are now submitting them one after the other, and we think the exercise cannot continue in perpetuity.
So all these persons are teachers?
They are all supposed to be teachers.
Wow.
They are all supposed to be teachers.
In the, who are in the classroom? Or this is part of the validation?
Unfortunately, the validation we are doing now will not be able to even tell whether they are in the classroom or not. Because when we finish with what we are doing now, all this service will have to go to the regions and the districts and the villages to find out whether the people are indeed at post.
Okay.
What we are doing is just looking at the documentation, whether documentations are right, what is the problem, why was the appointment letter backdated, why was the person employed without the financial clearance, why was the person employed without the establishment warrant. These are the things we are looking at now.
Right, so from those issues to do with labor, let's move up north, where one of the biggest threats to reducing maternal and child deaths in the Jirapa district of the Upper West region is the refusal by the people to do away with socio-cultural practices. Some of these practices are not only obsolete, but also inimical to the growth and development of the community. The Health Service District Director for Jirapa, Phoebe Balanguyentimi, speaking at the Commission of New Community-Based Planning and Services Compounds, CHIPS compounds at Taamapuo, asked the people to modify ways of doing things and cultural beliefs if they can't put a stop to them, to enable pregnant women in the communities attend to hospitals or clinics for antenatal care. Here's a report by Rafiq Salam from Taamapuo in the Jirapa district.
We used to walk long distance carrying our babies at our back. We get to the clinic tired, and when the nurses ask us to do any simple thing, we are easily angered.
Middle-aged woman Balu Banyokuon recounted the struggle and the pain she and other women went through in the past at the Duru Enclave to access quality medical care. 4 communities, namely Guo, Pokore, Kure, and Taamapuo, are close to each other but far away from the nearest health center located at Duru in the sub-district. When lumped together, they have a total population of a little over 1,500. To enable them access quality medical care, they have to walk over 10 kilometers to the Duru Health Center. They do that on bumpy roads, or in some cases, they have to walk on the mounds of their farms during the rainy season because the roads at that time are not accessible. However, all that has come to pass with the commissioning of a new community-based health planning and services CHIPS compound at Taamapuo for the 4 communities.
We are happy that we have a chips compound on our own. We will no more deliver on the road. We won't carry water for long distance. And we won't quarrel with nurses because we are tired. We want to thank the government and the people of Japan for this kind gesture.
It is one of the 64 chips compounds funded by the people of Japan and the government of Ghana. Greba, director of the Ghana Health Service, Phoebe Balagunyentimi, stated that the facility will help improve healthcare delivery in the district. She, however, urged the people to do away with negative and obsolete cultural practices.
We try to look at the practices that they have, find out why they have such practices or cultural practices. There could be very good reasons. We all belong to communities, we all have our cultural practices, we have our beliefs and everything. We cannot completely do away with them. But the negative ones, all we need to do is what? Encourage them to modify them. For instance, in some communities, if a woman is pregnant, the first month or first 3 months of pregnancy, she's not expected to announce it. They have to perform certain rituals. Now what we are saying is that perform those rituals early enough to enable this person come. Or if there is a way that this woman can come secretly and have access to the services without it being known to the community, and then later you can perform those rituals, fine, so that you don't step on their toes.
District Chief Executive for Graba, Cletu Seru Dapla, enumerated plans of the government to build more chips compounds in hard-to-reach areas in the district.
It is our hope that those that have not gotten, we have zoned them. We have zoned, if you check, this one is serving a cluster of communities. So those communities, the other communities that haven't benefited, we have zoned those communities and plans are underway. For instance, 2 of the chips compounds are nearing completion. We have earmarked to start 2 before July. So the rest that haven't gotten should be patient. We will soon come and deliver these services for them.
Reporting for J News, Rafik Salam, Taamapuo.
So Rafi got the pronunciation for that name right. He's from that part of the country. Taamapuo. I was saying Taamapuo. I can't even believe I said that. But that's the correction for you. That's his report from the Upper West.